Hello, my name is Brian. I'm a Saginaw Valley family nurse practitioner student. I'm going to be doing an assessment on you today. So first I'm going to inspect your auricles. Both are symmetrical, no signs of redness, no signs of lesions or masses on the front or the back. Now I'm going to palpate them. No signs of nodules, no signs of edema, any pain or tenderness?
Nope.
All right. I'm going to feel your tragus on both sides. Any pain or tenderness?
Nope.
All right, no masses felt, and they are symmetrical on both sides. Next, I'm going to feel your mastoid. Any pain or tenderness?
Nope.
It is symmetrical on both sides. No masses or nodules felt. I'm going to do a hearing test on you, so I'm going to have you plug one of your ears. I'm going to whisper a word in your other ear. You just repeat that word.
Hello.
All right, now do the opposite.
Apple.
All right, perfect. So now, I'm going to use the otoscope here, and I'm going to take a look in your ear. So ear canal is free of any debris. There is a little bit of cerumen. I'm not seeing any nodules or masses or lesions. I can see the tympanic membrane. It is a transparent pale gray color. The cone of light is present with the malleus directly above it, and there are no signs of any perforation. All right. Let me take a look at the other side here. So, similar to the other side, there's no lesions, masses, drainage, any type of redness or edema. I can see the tympanic membrane once again. It is the same pale gray color with the cone of light and the malleus, and then no signs of perforation. All right. And then we're gonna do a couple hearing tests here. First is the Weber, which is a conductive hearing test. So what I'm gonna do is I'm gonna hit this tuning fork on my hand. I'm gonna put it on your head. You just tell me if you hear it equally in both ears, or one ear is louder than the other. Okay?
They're equal.
Okay. Next is a sensory neuro test. It's called the Rennie test. So what I'm going to do is I'm going to hit this on my hand. I'm going to put it on your mastoid. You tell me when you can't hear it anymore, and then I'm going to put it in front of your ear, and you just tell me if you can hear it still, okay?
Okay. I can still hear it.
All right, now we're going to do the other side.
Okay. I can still hear it.
Okay, perfect. Now we're going to move on to your nose. Nose is symmetrical, no signs of deformity, no lesions. So I'm going to palpate your nose. The bone at the top of your nose, any pain or tenderness?
Nope.
Cartilage running down medially is intact, and then the lateral aspects are intact as well. So I'm going to have you plug one of your nostrils and then breathe out of the other one. Check patency. Okay, perfect. And then the other side. Perfect. All right, now I'm gonna palpate your sinuses, and you tell me if you're having any pain or tenderness with that, okay?
Mm-hmm.
So I'm palpating your frontal sinus,
No pain.
and then maxillary sinus.
No pain.
All right, now I'm gonna take a look inside your nose. All right, it is in its red color. I see no signs of edema, no signs of bleeding, no signs of drainage of any type. We'll look at the other side now. All right, hair is evenly distributed, but it is a nice red color with no signs of bleeding, no ulceration. It is intact. We'll look at your septum here. She does have a septal ring in place, but the septum on this side shows no signs of perforation or deviation. I'm going to take a look at the other side. septum on this side is intact as well with no deviation or perforation. All right. So, lips are pink in color. There's not chapped. There's no signs of any ulceration on top or bottom lip. Appropriate for her ethnicity. I'm going to do the transillumination of the sinuses. So I'm going to shine the light here and see how it goes to the sinus, and then here as well. And then I'm going to have you open your mouth and tilt your head back. I'm going to put this near your eye. All right. And this would be where I would do your lip, but we got out of order there. So, like I said, lips are good and intact. I'm going to have you open your mouth. All right. Can I have you pull your lips up a little bit? All right. Gums are intact with no sign of redness or drainage. Can I have you do the bottom now? Once again, the bottom is a pink color, no signs of ulceration. The oral mucosa in this is a pink color. Take a look. Yeah, pink color with no ulceration, no plaques, no nodules. Teeth do have some fillings, but there are no cavities that I see. All of her teeth are intact. Hard palate is a pink color. No ulcerations. It is intact as well. Slightly less pink than the oral mucosa. Tongue has a even texture throughout. No signs of ulceration. No signs of bleeding. Can I have you lift your tongue up? All right. Vasculature on the bottom looks good. No nodules. All right. I'm gonna have you put your tongue down. Pharynx is good. It's symmetrical on both sides. No lesions or ulcerations noted. Soft palate with the uvula is intact. It's symmetrical. Can you say ah? Ah. It rises and falls appropriately. Tonsils on both sides are intact. There's no signs of any drainage, no redness, no ulceration on either of those. All right. I'm going to place some gloves on and feel on your tongue for any signs of induration. We use this to grab your tongue. All right. All right. No induration or mass is noted. Now I'm going to feel your gums. Just tell me if you have any pain or tenderness. All right. Teeth are all intact and non-mobile. They are not movable. All right. Thank you.